You guys doing in there? Huh? Hey, do you know your rights? You know what? I'm gonna start making these videos like real soon because I'm getting sick and tired of what's going on in this country and I just can't take it anymore. You know? So, you want to keep watching something, you want to keep watching me, that's fine because guess what? You could get educated and that could be very profitable to your health.
The better thing to talk about, however, is the relationship between profits and cancer in the United States. And there was a study that was published, I believe it was in 1994. It was a 12-year program, 12-year study. They looked at adults who had developed cancer as an adult, not childhood cancer, but adult cancer, right? And this is the main types of cancer that we get here in the United States. They did a meta-analysis of these people all around the world who developed cancer as adults for 12 years and were treated with chemo. And they looked at the results. And they published the results in the Journal of Clinical Oncology. And the results? 97% of the time, chemotherapy does not work. 97% of the time it doesn't work. So why is it still used? One reason and one reason only: money. If you go to a medical doctor, an MD, with a sinus infection, and that doctor prescribes an antibiotic, he gets no financial kickback. Now, if he prescribes 5,000, of that antibiotic in 1 month, the drug company that makes it might send him to Cancun for a conference, right? But he gets no direct remuneration. It's not with chemotherapeutic drugs, it's different. Chemotherapeutic drugs are the only classification of drugs that the prescribing doctor gets a direct cut of. So if your doctor prescribes chemotherapy for you, here's how it goes, more or less. The doctor buys it from the pharmaceutical company for $5,000, sells it to the patient for $12,000, insurance pays $9,000, and the doctor pockets the $4,000 difference. And there ought to be a law. The only reason chemotherapy is used is because doctors make money from it. Period. It doesn't work 97% of the time. If Ford Motor Company made an automobile that exploded 97% of the time, would they still be in business? No. This is the tip of the iceberg of the control that the pharmaceutical industry has on us. Most people have no idea. When women get together and do a 5K run for breast cancer, all of that money, do you think any of that money goes to nutritional research? Do you think any of that money goes to homeopathic research or acupuncture or traditional Chinese medicine or naturopathic research? No. All of it goes to drugs and surgery, which do not work. Now, why aren't those women running for selenium? If every girl in this country took 200 micrograms of selenium, in one generation we'd eliminate breast cancer by 82%. That's a big number. Why aren't we doing that? Because medicine in the United States is a for-profit industry, and most people are completely unaware of this, and most people bow down to the altar of MD-directed high-tech medicine at their own demise.
My name is Sergeant Rick Schiff. I'm an 11-year veteran of the San Francisco Police Department. I hold the department's highest Medal of Honor for bravery. That used to mean a lot more to me than it does now. What I'd like to talk to you about today is my now 7-year-old daughter. This is an identical twin. Her sister is now dead. Her sister, when she was 4 years old, Kristen, developed a highly malignant brain tumor that had spread throughout her spine and her brain. The doctors told us that we had really two options: take her home, let her die, or bring her in for massive dosages of chemo and radiation simultaneously. In either event, she was going to die. They were quite certain of that, and very quickly. Believing her only chance to be the standard route, we gave her the chemo and radiation. It burned her skull so bad she had second-degree burns and her hair never came back. To change her diapers, we had to wear rubber gloves because her urine was so toxic and it burned her. At the end of 6 months, miraculously, she survived the standard treatment, although there was a high expectation she wouldn't. She still had cancer. We were told, sorry, we've done everything we can. Now she's going to die, probably within a couple of months. My wife and I, choosing not to accept that, started reading. The first book I picked up, the third chapter, discussed Dr. Brzezinski. As you may guess, I have some expertise in fraud. In fact, I'm quite certain there are enough attorneys in the room that I could be board-deared as an expert in fraud. And I conducted my own investigation. I have no doubt the man is not a fraud. I have no doubt that he does what he does out of earnest belief that his medicine works. And now you're in a position to judge for yourselves whether it works or not, but it's well established by the FDA that it's non-toxic. 18 months later, we took my daughter off the anti-neoplastin. She had not died. She had no signs of tumor. She remained free for 18 months of cancer. Within a month, the cancer was widespread in her brain. We put her back on Brzezinski's. By the way, at the objections of our doctors, for some reason felt that it had failed her. We put her back on. Within 9 weeks, the tumor was completely gone. She died last July of neurological necrosis. Her brain fell apart from the radiation. The autopsy showed that she was completely cancer-free. Out of 52 cases of that disease ever, no one died cancer-free, just Chrissy. So she didn't die of a terminal illness. She died of my inability to care for her properly, and she died from bad advice. She died because there's a government institution that disseminates false information and is not looking out for the welfare of the people. You know, ladies and gentlemen, I swore an oath 11 years ago, and I think most of us in this room swore at one time or another to uphold the Constitution. It says life right in the beginning.